Hey everyone, my name is Nathan. I'm currently a nurse over at Roper Berkeley in the recovery room, or the surgical services, and I'm also a nursing student for Charleston Southern's Master's in Nursing Education program. I'm currently in the process of completing an in-service for the hospital, kind of reviewing the diabetic medications used for weight loss as well as insulin resistance nowadays, and how they affect surgical services because we're seeing these used more and more frequently. So today we're kind of going to talk about the practices and how it affects surgery, as well as what we can do as nurses to help with that process. So, starting off, we're going to kind of talk about these medications and what classes there are. So, the new classes of diabetic injectable medications include GLP-1 injectables, SGLT2 inhibitors, and DPP-4 inhibitors. Big words, but basically all it is medications that affect how the body responds to insulin. In diabetes, we understand that insulin is either not produced by the body or is, in the case of type 2 diabetes, the body doesn't respond to insulin the same way. So these medications help the body be able to recognize the endogenous insulin and use it appropriately. Kind of that lock and key method where um, the key doesn't fit the lock anymore, and we're kind of using these medications to be able to force open the lock. A lot of people you do use these medications now for weight loss, as are indicated in bariatric populations. Some big medications you may see on the floor would be Ozempic, Mounjaro, Wegovy, Jardiance. Some of these medications are injectable, and some of these are oral tablets. And we'll talk about how they affect surgery in just a second. So, how do they affect surgery? Number one, they delay gastric emptying. These medications often what they do is they cause your stomach to slow down. So patients may say they feel full longer, which is one of the reasons why they don't eat as much, and therefore you have weight loss. So how that affects surgery is whenever we have someone in surgery, we tell them not to eat for 24 hours beforehand or the night before. And if your stomach empties not as fast, you may still have residual food product left in your stomach, and then that increases your risk for aspiration. So patients were undergoing procedures and having aspiration due to the stomach contents that was not digested due to the gastric emptying being delayed. So these medications also can increase your risk for diabetic ketoacidosis because you're having to fast before surgery, and then you're under a lot of stress, which it causes metabolic changes. Um, in combination with these medications, you may also have hyperglycemic reactions, as well as more post-operative complications related to hyperglycemia, metabolic acidosis, as well as aspiration risk. Some pre-admission education. So if this is before patients come to surgery, this can be for outpatient or ambulatory services, as well as those who are on the floor. So let's say you get a patient and you notice they are taking Ozempic. You want to ask them when's the last time they take that medication, and then the last time they had something solid to eat. You ask that because for GLP-1 injectables, you have to have clear liquids from that midnight beforehand to the day of surgery, and then NPO after that midnight. So let's say I'm having surgery on Monday. On Sunday, I can only have clear liquids because those clear out the stomach a lot faster than solid food. Um, and then at midnight, I would be NPO following like most normal procedures. You tell them to hold the medication for at least 7 days prior to the surgery. Usually, these medications are administered once a week, so you just tell them to skip that week, usually. Um, and then for SGLT2 inhibitors, sorry, mouthful. These are PO medications, so these usually are tablets taken every day. You just tell them to stop taking it 3 days before surgery, and then again NPO the day from that midnight of surgery on. And then for the DPP4 inhibitors, we tell them not to take the date of surgery. It's okay to take all the way up to. And then again, just NPO for the day of surgery. The big one to remember is the injectables. Hold it for 7 days, clear liquids the night before, and NPO at midnight. So I've been asked this question before. How does this affect emergency situations? So patients that come in and they need emergency lap appy or a lap chole. They may not have been able to hold their medication for 7 days, or they might have ate yesterday. So what anesthesia needs to be aware of is that these medications are in the patient's system and they did not follow protocol. So we want to tell them that they're most likely going to have rapid sequence intubation. So they're going to not get something like an LMA or laryngeal mask airway. They're going to need full intubation. It's going to need to be rapid, and we may end up doing OG or NG suctioning to help reduce the aspiration risk. And then you want to tell them in advance for any procedure that they do take these medications so staff can be aware. And this can be done in like a med rec. And then these are some of the references. Here's a little card. I'm going to be passing these out to most of the units throughout the hospitals. This is just kind of tells you what the medications are, what class they fall under, as well as what the procedure should be for. If you have any questions or anything, feel free to reach out to me and just shoot me an email at nathan.low@ripperstfrancis.com.